talk about those pandemic precautions, and we're starting to see some of those changes. I was just talking, about those 3 universities in the DC area. We also know in Philadelphia, they took that step of reinstating that indoor mask mandate. That the counts really, we're not so sure that they're providing a full picture of where we are in this pandemic, because if you test at home and you're not reporting those results, how do we know what the true numbers are anymore?
Yeah, I mean, in those statements, you have a lot to unpack in there. So I think what you see different regions doing, and if you were to go to the CDC website, the strategic way of thinking about it is each area has its own micro prevalence of the virus as it goes up and down. So I think each region should make a judgment. Okay, we are seeing an uptick in the virus. We're going to do a little mask wearing in big public spaces. I think that's perfectly fine, and use the judgment of the local, folks to do that. I think that home testing is a whole nother issue that doesn't really get the number registered, so we never know how many people have positives. But in general, we know that when home testing goes up, the other testing goes up. But typically, the home testing is so convenient now, unlike before, we really are not going to understand it.
All right, before you wanted a home test so badly because you needed the convenience of it, but now that we have the convenience, then we're lacking the data.
Yeah, and the data, even when we were doing this, remember, some people said, oh, this community has the highest rate of the virus, positive tests. I said, well, that community has the highest rate of testing, right? Now, so that doesn't mean they have the highest rate of positives, but they may just have more testing available. Now we're doing it at home. Who can afford to test more at home, right? So you're going to have some communities that can test more at home, some that can't. So that's why I've always said the number that matters most to me is how many people are in the hospital, and that is the number that shows me the burden of the disease in the community.
And obviously you run hospitals throughout the country. So what are you seeing? What is it like now?
Well, the great news, just like across the United, and we pretty much represent the United States at Common Spirit. We're in 21 states. We're in about 35 cities with 150 hospitals. So what we see is the country sees, and everything is just on the downslope. Okay, so in terms of hospitalizations and mortality, and they continue to go down. So we're thinking we're in a good space in terms of that. Now, the new variant is on the rise, but not many people are coming in the hospitals.
And the good news is, too, now that we're creeping into that real feeling of spring, we're also going to be able to add in that one component, ventilation, being able to open the windows again and do things outdoors, which, from what we've learned over time is really, so important.
Yeah, I mean, the options, during the springtime, your options of social gathering just multiply because you can go outside, you can go to the park. It's been a cold spring, though, in New York.
Yeah.
I don't know what's happening, so that's not right. But in general, across the country, people should gather outside still. I think it's still a smart idea. If you can go outside, open the windows, I think it just makes perfect sense.
Now,